Board-certified obstetrician, gynecologist, and chief medical officer at Verywell Health. Dr. Jessica Shepard joins me now for more on this. Dr. Shepard, how do these drugs normally used for diabetes and now weight loss, how are they now being used to help PCOS? How does this work?
Yeah, as we heard before, that really PCOS, I think that name is very misleading because polycystic ovarian syndrome actually has to do more with the metabolic system. And like we were talking about, the insulin glucose ratio and also obesity and how they factor into some of the things that you see with PCOS. So what you're seeing with these medications is that, one, it's decreasing weight, but it's also addressing some of the issues that occur metabolically internally, which in turn helps improve insulin sensitivity with the peripheral tissues. And that's really where we're seeing these outcomes. Just like you heard, someone's cycle was able to respond regularly in addition to weight loss.
We've heard that these drugs aren't appropriate for everyone who's looking to lose weight. So what do people need to consider if they're trying to use these drugs to address PCOS?
Yeah, so when we look actually at the medication, it's not FDA approved for PCOS, and it's approved by the FDA to treat type 2 diabetes. Now, there are some overlap between PCOS and type 2 diabetes, but you really would have to talk to your doctor to see from the symptoms that I'm having from my PCOS, or maybe it's weight reduction, how is this going to help me? Because, your physician needs to decide, as an off-label use, is this something that you would use for PCOS symptoms, and in turn, have resolution of the symptoms.
Now, PCOS is often under-recognized. So what do you think are some red flags that people need to look out for? And what do you do if you think you might have this?
Yeah, I think this is worth a conversation, even if someone suspects that they may have it. But typically the signs that we look for are very irregular cycles. And usually that's a very common symptom that women come in with, in addition to weight. Now, that's, again, not necessarily has to be the only thing that you would see, but we also use some lab values to help kind of gather, is this a diagnosis of PCOS? And then also looking at some of the things that we may see on ultrasound, which also may indicate.
All right, Dr. Jessica Shepard, always great to have you, doctor. Thank you.
Thank you so much.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.